the FDA gave the New York State Department of Health approval to use on a compassionate care basis a drug that we think has real possibility. On the drug therapy, Tuesday we're going to start the hydroxychloroquine with the Zithromax. That's the drug combination that the President has been talking about. The FDA approved New York State Department of Health to proceed with an experimental drug, again on a compassionate care basis. But what it does is it takes the plasma from a person who has been infected with the virus, processes the plasma, and injects the antibodies into a person who is sick. And there have been tests that show when a person is injected with the antibodies, that then stimulates and promotes their immune system against that disease. It's only a trial. It's a trial for people who are in serious condition. But the New York State Department of Health has been working on this with some of New York's best healthcare agencies, and we think it shows promise, and we're going to be starting that this week. The numbers today, total tested up to 78,000, tested overnight, 24-hour period, 16,000. As of yesterday, about 25% of all the testing nationwide is being produced right here. Number of positive cases, we are up to 20,000 statewide, 5,000 new cases. We have right now on hospitalizations, 13% are being hospitalized. 13% is down. It has gone as high as 20%, 21%. Of that number, 24% require the ICU beds. New York, we have 20,000 cases. New Jersey, 1,900. California, 1,800. So proportionately, in absolute terms, New York has by far the greatest need in the nation. The greatest density control issue right now is in New York City. I saw the issue myself. I told New York City I want to plan. Yesterday I said I want to plan on how they're going to control and reduce the density. I want the plan today. I want the state to be able to approve the plan. It has to focus on young people and the gathering of young people. I've said it before. You can get it. The numbers show you can get it if you're a young person, and you can transmit it. If New York City needs legislation to enact their plan once we approve it, I would ask New York City to pass that legislation quickly. If they have a problem passing legislation, they should let me know. But also, our numbers will be higher on positives because we're doing more tests. We are today issuing an emergency order that says to all hospitals, you must increase your capacity by 50%. We would ask you to try to increase your capacity 100%. We are going to the entire retired community, healthcare professionals, and who are licensed, registered, and we're saying we want you to enlist to help. We have 30,000 responses to date, and I'm doing an emergency order, executive order for all nurses who are registered to enlist. And the Department of Financial Services is sending a directive to insurance companies. Health insurance companies employ many nurses, doctors, etc., in the insurance business. We're saying to the insurance companies, we don't need them in the insurance business now. We would like them to help in hospitals. Supplies are the ongoing challenge nationwide. Masks, PPE, ventilators are the #1 precious commodity. I'm competing with other states. I'm bidding up other states on the prices. It's not the way to do it. I was speaking to Governor J.B. Pritzker yesterday about this. Why are we competing? Let the federal government put in place the Federal Defense Production Act. It does not nationalize any industry. All it does is say to a factory, you must produce this quantity. That's all it does. We have had success securing supplies. We're going to be dispatching them across the state today. New York City, for example, 430,000 surgical masks, 176,000 pairs of gloves, 72,000 gowns, 98,000 face shields, 169,000 N95 masks, which are very precious now. They're about $7 a mask. Hospital capacity, I'm on my way down to the Javits Center today. I want to make sure those hospitals are getting up right away. Then we're going to use Stony Brook, we're going to use Westchester, we're going to use Old Westbury. The Javits hospitals, for example, those are 1,000 beds right there with the equipment, with the ventilators, and with the staffing. So that's a big deal.